Good afternoon. Welcome to People's Choice by Intermountain Healthcare, where we ask healthcare executives to guess what the public says about healthcare topics. Let's meet our contestants. First, we have Bernie Eskridge from the University of Missouri. We have Lindsay Blomquist from Intermountain Healthcare and Dr. Stan Huff from Intermountain Healthcare. Please tell us a little bit about yourselves.
I'm an associate CMIO at the University of Missouri, or MU Healthcare, in Columbia, Missouri. And I thought I'd share that the embarrassing thing I watch on television is actually WWE wrestling on occasion.
There's nothing embarrassing about that. Although, Roddy Piper,
it's a travesty, really.
It is a travesty.
I can't, although Ronda Rousey kind of did a little homage, which I liked.
I do too.
Yeah.
Right, yeah. Lindsay, tell us about yourself. And, of course, the most embarrassing thing you watch on TV, as long as it's not Meet the Kardashians. We won't accept that.
I'm the Director of Strategy for the Revenue Cycle Organization. And the most embarrassing thing I watch is the Golden Girls.
Oh.
Because one day, that's what I aspire to be.
Thank you for being a friend, Lindsay.
Yeah.
Travel down the road and back again. Her heart is true. She's a pal and a confidant.
I love that you know that.
Oh, yeah. Big fan of Golden Girls. Big fan. Right here. Dr. Huff, tell us about yourself.
So I'm the Chief Medical Informatics Officer for Intermountain, and my devilish TV show would be The Last Man on Earth.
Last Man on Earth. I love that show. I love that show. So do you think he's going to find it? Have you watched this season yet?
Well, I've seen part of it. I saw where the woman showed up and some of the interactions, and then I got to pick up from there.
Great show. I gain a whole new level of respect for Dr. Huff. Awesome show. Well, thanks, contestants. We're really happy to start the game show right now. Let's go with our first question, shall we? What is the biggest problem with healthcare in general? Lindsay definitely had that one.
It's too expensive.
Too expensive? Survey says... Bam. Cost. Well done. Yes, representing
ya.
Intermountain very well and representing the female persuasion very
That's
well as
right.
well. Let's see the responses for number 2 and 3.
Yeah.
Doctors not taking time to listen and restrictive government regulations. Interesting. Does it surprise you that cost is first? Obviously not Lindsay. How valid a concern is it?
I think as we see more and more payers move to like the high deductible model, it is increasingly a cost unless we see ourselves and insurers move more to a pay-for-performance model.
Yeah. Good comment.
And I think that as we're going to the high deductible health plan options, the cost is becoming more visible to them, because before their insurance company was likely covering a large portion of that, and now they're seeing that it's their accountability. So they're actually seeing, when I go to the ER, instead of just going to my doctor when I have a cold, it costs more and I have to pay for that. So
That's
I
a
think
great point.
it's great.
That's a very good point. How about the second comment? Doctors don't take enough time to listen. That seems like a really concerning thing that the public would say. What do you think, Dr. Huff?
I think it's a consequence of the pressures that are being put on physicians. It's become a very important sort of business, and a lot of compensation depends on RVUs, or at least you've got to be aware of how you're doing. And then I think, unfortunately, given my part in the trade, I think electronic health records are not as user-friendly as they should be, and they detract from time that the physician would have had to do more personal interactions with the patient.
So what do you do about that? How do you make them less intrusive?
Well, I think they just to be created with the user in mind, with a lot of input from physicians, and my experience would say we never get that right the first time, so you want to have people who are doing the development very close to the physicians and see what works, actually try it, and iterate, rapidly in an agile fashion to try and make better software.
Yeah, that sounds like a good approach.
Yeah,
Please,
so
Bernie.
I completely agree, and I almost feel as though we'd get to a better place if we could develop with the relationship in mind, not just the user or the physician, but with the relationship in mind, and see the EHR more as a tool to be used by both individuals, not just the physician.
Okay. Yeah, great comments. Thank you. What about this third one? Restrictive government regulations. Is that, in fact, a concern that you share with the public?
Yes.
Please elaborate.
it remains so difficult to basically honor requests we get from our patients or our consumers because of red tape. And I think also it seems to limit and stifle sometimes the rate at which we could make a lot of advancements that would solve the first two problems.
So, especially from a standards perspective, Stan, what do you think? Is the government?
So
interfering too
I
much?
have to confess, see, that I'm part of, the Healthcare Information Technology Standards Committee, the ONC committee and so I've thought about this a lot, and I couldn't agree more. And I guess the thing I would say is it's unquestionably true. And the situation is, I guess the interesting part is that people start out with good intentions, and so nobody intended this to be wrong or bad, went into it with the best of intentions, but then there are just unforeseen consequences, and there's a lot lost in translation between the intent of policy setting committees and then the way regulations actually get made. And so, yeah, I think unfortunately, for instance, we're in a situation where the certification requirements for EHRs are like a vampire, sort of sucking creativity and innovation out of EHR systems. I mean, it's just
Interesting. That's a good way to put it.
so it's
Lindsay,
You wonder sometimes too when they're making these policies, do they really understand healthcare operations, the actual business and the way that our process flows are? Because sometimes when you look at the regulation that comes out, you're wondering, how in the world do I operationalize that? How do I make my billing system do these three things now that they say that I have to do with a bill in order to submit it to Medicare? And so it's almost, you wish there was someone in there that understood the operational nature of hospitals.
so did the public miss anything? Do you have any concerns that the public didn't bring up?
we make too many mistakes. And that's why we really need usable, good information systems which incorporate clinical decision support. As people have said, it used to be medicine was simple and we didn't have much impact. Now we have therapies that are effective, but if we're not careful, we hurt or kill people when we make mistakes. And people are not perfect information processors, and so we need to take action to use all of the tools that we can to try and improve the safety of healthcare along with the cost and patient satisfaction.
Great comment. Thanks a lot, contestants. Lindsay definitely won that round. Thanks for joining us for People's Choice by Intermountain Healthcare.